I would like to welcome you to the St. Joseph's Hospital Total Shoulder Replacement Program. We are pleased you have chosen our facilities for your total shoulder replacement surgery. Our goal is to return you to the best of health as soon as possible. There's a lot to think about before surgery. Today, we're going to provide you with information to help you become familiar with the process involved with your surgery, hospitalization, and recovery. We hope this will answer your questions and reassure you about your total joint surgery. Learning as much as possible will help you play a more active role in your recovery. Welcome to St. Joseph's Hospital. All of our total shoulder patients will be cared for by our specialized orthopedic care team before and after surgery. Here at St. Joseph's Hospital, we follow a clinical pathway of excellence. We utilize cutting-edge technology and techniques, which allow the majority of our patients to leave the hospital the day of or the day after surgery. Pain management techniques, including our multimodal approach, helps decrease narcotic consumption. 95% of our patients leave the hospital and are discharged home or with home health care if ordered by your physician. We also strive for top decile patient satisfaction scores throughout our facilities to ensure you have a positive experience while here for your surgery. St. Joseph's Hospital promotes a healthy lifestyle. There are no smoking areas in our facility. If you smoke, you might want to consider stopping prior to surgery. If you feel you will need a nicotine patch for your stay, please notify your surgeon. Preparing for your surgery preoperatively is an important aspect to your overall care and recovery after a joint replacement. In order for your surgeon to do their job to the best of their ability, your surgeon needs to know about your medical history. Your surgeon or primary care physician will perform a pre-op physical to ensure that you are healthy enough to undergo total shoulder replacement surgery. If you have any cardiac history, they will also have you follow up with your cardiologist to get cardiac clearance before surgery. Prior to your surgery, you will have an appointment with pre-admission testing. The pre-admission testing department will call you to schedule this appointment. They will be going over medications, advanced directives, preoperative instructions, and additional necessary testing. They will ask you for a thorough list of your medications, including prescribed medication, over-the-counter medication, and supplements. Based on anesthesia guidelines, there may be medications that must be stopped in order to have a safe and successful joint replacement. During this appointment, a pre-admission testing nurse will instruct you to stop taking certain vitamins or medications 2 weeks prior to your surgery. You cannot take ibuprofen, Aleve, Advil, or Motrin 7 days prior to surgery. Tylenol is fine to take up until the day of your surgery. If you take a prescribed blood thinner, such as Coumadin, Pradaxa, Plavix, Eliquis, or Xarelto, you will receive special instructions on when that needs to be stopped. During your pre-admission testing appointment, you will have your MRSA and MSSA nasal swab completed. If positive, a nurse will contact you for treatment to help prevent infection after surgery. Additionally, you will be provided with a soap called Easy Scrub CHG at your appointment. You'll be instructed to wash with this soap 5 days prior to your surgery. The day of surgery, you will wash only with soap and water. Do not apply any lotions, creams, deodorants, or makeup the day of surgery. Finally, any additional blood work or EKG not yet completed can be obtained. Keep in mind, your surgeon should be notified of any changes to your medical condition or medications prior to your surgery. Insurance coverage. Healthcare benefits are constantly changing. It is important for you to understand your benefits before undergoing surgery. Call your insurance provider to find out exactly what your plan does and does not cover. You may be prescribed a blood thinner after surgery. The copays on these medications may be costly. You may want to call your prescription insurance to find out what your copay will be on these medications. The 4 most common medications prescribed are aspirin, Lovenox, Xarelto, and Eliquis. If you're prescribed aspirin as your blood thinner, it is not a costly medication. How they determine which blood thinner you will be placed on is based on your surgeon preference and your medical history. Scheduling office phone call. You receive a phone call from the scheduling office the day before surgery. They will call any time between 3 p.m. and 6 p.m. to tell you what time to report to the hospital on day of surgery. They will also instruct you to have nothing to eat or drink after midnight. If you are told to take medications the day of surgery, take with a small sip of water. If you're not home, they will leave a message on your voicemail. If you are a Monday surgery, you will receive a Friday afternoon phone call. Physical conditions changes. Report any changes in your physical condition to your physicians. A number of problems may require the postponement of your surgery. These include a sore throat, a cold, fever, dental problems, difficulty urinating, and skin conditions such as rashes or abrasions. If you have any questions about whether you are healthy enough to undergo surgery, please ask a member of your healthcare team. Healthcare directives. A healthcare directive, also known as a living will, gives a person of your choice the power to act on your behalf during any medical emergency you may suffer. This document is used to ensure that your wishes are followed even if you are no longer able to communicate them yourself. If you already have a living will completed, please bring a copy to the hospital so it can become part of your records. If you would like to have one filled out before surgery, you can find the form on page 19 in your booklets. BayCare in St. Joseph's Hospital priority is the health and wellness of our communities and keeping patients, team members, and physicians safe. There have been enhanced safety and cleaning measures to ensure a safe environment while in the hospital. For additional information regarding visitation hours, please contact the hospital directly for the most up-to-date information. As you prepare for your surgery, we would also like for you to prepare your home. Your Total Shoulder Education book has a checklist of ideas to prepare your home for return after surgery. For example, we would like for you to remove tripping hazards like throw rugs, loose cords, and any clutter before surgery. It may also be beneficial to move frequently used items to waist level. You can look through the checklist for other suggestions. Meal preparation could be beneficial. As you are recovering, you may not be up to cooking a full meal. Your book also provides some guidance on what to bring to the hospital. Bringing a few items from home may make your hospital stay more comfortable. The hospital does provide you with toiletries, such as a toothbrush, toothpaste, lotion, etc. But some people prefer to bring these items from home. You will be provided with a hospital gown to wear during your hospital stay, but some people prefer to wear their own clothing. If you would like to bring clothing from home, make sure to bring clothing that are loose-fitting and comfortable. Loose and comfortable oversized t-shirts or button-down short-sleeve shirts with larger buttons are preferred and will be easiest for you to use after your shoulder replacement. The hospital does have free Wi-Fi available, so if you would like to bring an electric device such as a laptop, iPad, tablet, etc., you may. It is also important to bring your own dentures, hearing aids, or CPAP machine if used at home. I'm going to talk to you a little bit later about the potential use of on-campus pharmacies we have available for you. If you are interested in using that pharmacy, you will want to bring in a credit card, debit card, or cash so you have a form of payment for your copay. Please do not bring any medications from home. During your hospital stay, the nurse will be providing you with medications from our inpatient pharmacy. The hospital is not responsible for any lost or stolen items. Please leave all jewelry and valuable items at home. As mentioned in the previous slide, preventing falls is a crucial part of your safety after surgery. This list describes some of the easy ways you can try and prevent falls at home by preparing prior to coming in for your surgery. Your hospital stay. Keeping you safe is our top priority. We will regularly ask you to identify yourself by stating your name and birth date and comparing it to your identification armband. The barcode will be scanned on your wristband for medications and procedures. This ensures we provide the right treatment, tests, and medications during your stay with us. One of our goals is to prevent the spread of infection to our patients. Your healthcare team will wash hands with soap and water or use alcohol gel before and after each patient encounter. If you have concerns that your healthcare provider has not washed his or her hands, please speak up and ask them. Your surgeon may also order IV antibiotics before and following your surgery to help prevent surgical site infections. Additionally, any visitors should also wash his or her hands before entering and leaving your room. Finally, we want to perform the correct procedure on the correct patient at the correct site every time. We will ask you to be involved in this process by identifying your surgical site and confirming the site that your surgeon marks. The day before surgery, you will receive a phone call from our surgery schedulers between 3 and 6 p.m., advising you of your arrival time to the hospital. If you are a Monday case, you will receive this call on Friday. During this phone call, you will be instructed a time on when to stop eating and drinking prior to your surgery. It is important to follow those instructions to allow us to safely proceed with your surgery. If you have certain medications that are safe to take the morning of your surgery, please use a small sip of water to help get those medications down. On the morning of your surgery, you will come to your hospital and be brought to the preoperative area. Once admitted to the pre-surgery area, you will be introduced to your preoperative nurse. Your chart will be reviewed, and any additional testing that needs to be done prior to surgery will take place at this time. An intravenous line, also known as an IV, will be started. This IV will stay in place the entire hospital stay and will be used to administer fluids and medications. Any belongings you bring in with you will be securely locked up during surgery. You will also meet with your surgeon and one of our excellent anesthesiologists who will speak to you regarding your overall health and medical conditions to determine which type of anesthesia is best for you. If your surgeon has ordered it, you may also get a nerve block that numbs your shoulder and arm, including your hand and fingers, to assist with pain control after surgery. The block is a regional anesthetic technique. It is a safe and effective way to provide excellent post-op pain control for you. The block works by numbing the nerves that run down your arm. These nerves are responsible for transmitting signals to the brain that indicate pain. By blocking this, it will help with pain control after your surgery. You will still receive anesthesia on top of this block. It will last 24 to 48 hours and works along with your other medications. As it wears off, you may start to experience an increase in pain. From the pre-surgery area, you will go to the operating room, also known as the OR. You are generally in the OR anywhere between 1 to 2 hours, just depending on what the surgeon needs to do. When your surgery is complete, you will go to the recovery room and your surgeon will either call or visit your family member to provide an update. After arrival to the recovery room, you will meet your recovery room nurse. They will be frequently monitoring your vital signs and pain to ensure you are comfortable after your surgery. You are usually in the recovery room from 1 to 2 hours. After the recovery room, you will transition to the orthopedic unit. If you are scheduled to leave the same day as surgery, you may stay in the recovery room and be discharged from there. This plan should be discussed with your surgeon prior to surgery. Once on the orthopedic unit, they will also be monitoring your vital signs and pain regularly. This does continue throughout the night. We are not trying to wake you up every 4 hours, but you have had a lot of new medicine on board and are still coming out of the anesthesia. So we need to keep a close eye on everything. Your healthcare team will try to cluster your care to try and provide you with as much rest as possible. Once you get to the orthopedic floor, we will be starting you on oral pain medications. You will receive high doses of Tylenol around the clock and incorporate narcotics as needed. Your diet will be advanced as tolerated. You will be started off with clear liquids and advanced to regular foods if there is no nausea or vomiting. Physical therapy will also see all patients the day of surgery. They will take you for a short walk with the use of a walker. Most patients do very well the same day as surgery and are able to walk a far distance. After surgery. After your surgery, you may have a few different lines connected to you. One of those new lines is a nasal cannula, delivering oxygen. Getting you moving and using your bedside incentive spirometer 10 times an hour will aid in quickly removing this line. We ask that you take the incentive spirometer home with you and continue to use it over the next couple of weeks. After surgery, you may have a pair of pumps, also called SCDs, placed on your legs. These are simply sleeves that go on your calves and periodically pump up air within. These will stay in place until discharge while you are in bed. The purpose of these is to help prevent blood clots. To help us measure your pain after surgery, we will ask you to rate it before and after a dose of pain medication. Rate your pain on a 0 to 10 point scale. It is important to understand that all surgical pain cannot be taken away. Our goal is to make your pain tolerable, which is generally around a 4 or less on the pain scale. Keep in mind that when you work with therapy or perform range of motion exercises, the pain will likely increase for a short time. While medications may help control some of your pain, there are other methods you will find helpful to assist in making you more relaxed and comfortable. Ice is extremely important. We'll be giving you an ice wrap after surgery. You will be able to take this ice wrap home with you. While you are here at the hospital, we will put ice on your shoulder consistently. We ask that you continue to ice at home. The more swelling you can keep out of that area, the less pain you will have. At home, we ask that you ice at least 3 to 4 times a day for 30 to 40 minutes at a time. Your diet will be advanced as tolerated. You will be started off with clear liquids and advanced to regular foods if there is no nausea or vomiting. Occupational therapy may visit you while you are in the hospital, depending on your surgeon's preference. If ordered, occupational therapy will educate you on range of motion exercises, sling use, and assist with dressing. As you recover from your shoulder replacement surgery, your surgeon will have provided you with specific limitations in an effort to protect your new joint replacement. New shoulder joint replacements are non-weight bearing postoperatively and in a sling for a period of time designated by your specific surgeon. You should not be picking anything up heavier than a 6-ounce glass of water. In addition to non-weight bearing, you will have limitations on the positioning of your new shoulder replacement, including no overhead and across the body movements. These limitations will be discussed in further detail by your occupational therapist or orthopedic surgeon and should be continued until your surgeon advises you to progress. A sling is used to support your arm after surgery and should be worn at all times, unless otherwise specified by your surgeon. Your therapist will inform you of your surgeon's protocol. Wearing the sling correctly is very important. Be sure your elbow is all the way back into the pocket and that your arm is well supported. Additional sling information can be found on page 23 and 24 of your total shoulder book. Your therapist will ensure you are wearing the sling appropriately prior to discharge. Your sling should be worn postoperatively until your surgeon tells you it is okay to discontinue. Ice is a very important component to your recovery and comfort. It helps reduce swelling, inflammation, and pain. You will be provided with an ice pack wrap and 4 refreezable ice packs. These are yours to take home, and we encourage their continued use. You can apply this ice pack to your shoulder immediately after surgery. This is a list of some of the exercises that you should perform to help promote healing, increase range of motion, and reduce pain and swelling. This list is located in your total shoulder book that you received preoperatively. It is important to review these exercises prior to arrival to the hospital and get familiar with some of the basic exercises you will be performing. You can do these exercises 2 to 3 times a day. If you are not scheduled to leave the same day as surgery, you will spend the night on the orthopedic unit and will likely be discharged the next day. If you are staying overnight in the hospital, the day after surgery, a staff member will be getting you up out of bed to the chair for breakfast. The nursing staff will help you order your breakfast. You will also see the surgeon, physician assistant, and/or hospital medicine doctor if consulted. They will ensure that you are progressing well in your recovery and start to plan for discharge. If ordered by your physician, occupational therapists may come to see you. As mentioned previously, occupational therapy will work with you on range of motion exercises, sling use, and activities of daily living, including bathing, dressing, and functional activity. This is all dependent on your surgeon's preference, and not all patients will receive occupational therapy. If a home health consult is ordered by your surgeon, a home care coordinator will be visiting you and finalizing all your home care arrangements while you are in the hospital. The home care coordinator will be advised of your surgeon's preferences, as well as which agencies your insurance will cover. They will verify your insurance and the address that you will be staying at after surgery to ensure a safe discharge home. You should receive a phone call from the home care agency by 12 p.m. the day after you are discharged. They will schedule an appointment at that time to come out to your house. The hospital will also make sure you have all appropriate medical equipment prior to discharge. This may include a cane, specialty walker, or shower chair, depending on your therapist or surgeon recommendation. You may have a copay depending on the type of insurance you have, but we will discuss this with you prior to ordering. Please hold on to all your durable medical equipment for at least 5 years. Medicare will only pay for an assistive device for you once every 5 years, so do not give your equipment away or loan it out. The average length of stay after a total joint replacement is 1 to 2 postoperative days. Some patients will leave the same day as surgery if this has already been arranged by your surgeon. We do our best to provide a discharge time for you. On average, most of our patients leave the hospital sometime between 10 a.m. and 11 a.m. We will have a better idea of that discharge time when we reach your day of discharge, but this time frame will allow you to prepare for obtaining a ride home. After a shoulder replacement surgery, most patients will be discharged with a few new medications. Your surgeon will be prescribing these for you to take home. Most patients will be discharged with narcotic pain medications. The most common side effect of narcotics are constipation, nausea, vomiting, and itching. You may also be discharged on either an oral anticoagulant, such as aspirin, or an injectable anticoagulant if ordered by your provider. The medication is to help prevent you from developing a blood clot after surgery. The most common side effect associated with these are increased risk of bleeding and upset stomach. Additional prescriptions may be included, such as anti-inflammatories, stool softeners, and Tylenol. If you need your prescriptions filled, we are able to do so before you leave the hospital and have them delivered directly to your bedside prior to your discharge. You will need to bring your prescription card to the hospital and will be responsible for any copays at time of delivery. If you would like to use this pharmacy, make sure you bring a credit card, debit card, or cash to pay your copay. There are no refills on these medications, so you do not need to worry about coming back. You do not have to use this pharmacy. It is just meant to be a convenience for you. This card will be provided to you upon discharge. It is to be used if you find yourself needing to visit an emergency room. The card should be shown to the medical provider as our surgeons want to know if you are in the ER. Most issues do not warrant an ER visit. Pain or incision concerns do not need to be seen by an ER physician and should be managed by your surgeon by calling their office. Chest pain and difficulty breathing are appropriate reasons to visit an ER. Once you are discharged, if you have provided the hospital your email address, you will receive a link sent by the hospital. Please click on the link and you will be able to access your medical records. After you are discharged from the hospital, you may receive a survey in the mail asking about the care you received while you were recovering in St. Joseph's Hospital. Please take a few moments to fill this out. In order for us to always provide our patients with high quality care, we need your feedback. Thank you for taking the time to review this information. The total shoulder replacement team wants to ease your pain and help you regain your independence. Following the instructions in the book will help ensure you heal as quickly as possible. If you have any questions, please feel free to reach out to me and I will be happy to help. We will also contact you at the completion of this class to answer any questions you might have. Thank you.